What are some variations of facelift incisions? The great part about this is we have great solutions for that. And the scars, the position of incisions for facelifts have evolved a lot over the years, and we have very refined ways of placing those incisions to make them virtually invisible. So the incision starts here in the sideburn or along the sideburn, and that really depends. There's decision making involved here, and it really depends on how long your sideburn is and how your hairline is, so that we can create and preserve a very natural look to that area, because that is really a beautiful area in the face. It goes unnoticed, but the beauty of it is that it goes unnoticed and blends in with your face. So we want to go either along or inside the sideburn, and we'll go here. When possible, I like to go inside the sideburn and not shift the sideburn too much. And then we go in here, then we want to go behind the tragus. So there's a variation of this where people sometimes place the incision in front of the tragus or create a pattern in front of the tragus. The downside of that is you're going to have a visible incision in front of the ear. No matter how beautifully we close that incision, an incision placed in an unnatural location can still be visible depending on the position of the head, the lighting, and so on. And so we want to be careful, and I like to place that incision behind the tragus so that it breaks the incision line and the eye doesn't catch it. When we do that, we're very careful. There's certain specific techniques we use to preserve the natural contour and topography of the tragus. We don't want to distort the tragus either by doing that. So there's again some refinement that goes into that. And then the incision continues here inside that natural groove that we have where our lobule is. We don't want to distort the lobule either, because that could be a telltale sign of a facelift. So we want to be very careful about how we place that and not place any tension on the lobule. And then we go behind, and the lobule is the earlobe. And then we go behind the ear, inside that groove, and then either inside the hair or along the hair. And then that again depends on some features related to where your hairline is and what we're achieving with the facelift. Now, that incision has variations, and it's very important to tailor that incision to the type of facelift and to the patient and to your own anatomy. Also, a very important thing is when we do the facelift, we don't want the tension to be placed on the incision. So if it's one of those old school kinds of facelifts where you're just pulling skin, of course the tension is going to be on the incision, and that's where you're going to see unsightly scars, widening scars, and issues in that location. When the work has been done on the deeper structures, then those incisions heal beautifully and there's no tension on them.